Hello there, name's Faith. Welcome to my channel. I just came back from teaching ACLS in the last 2 days, and I thought of sharing to you this video about an app that I've been using in the past in order to build my confidence during the mega code. Up to this date, I still notice that nurses, also some of the physicians, to struggle in performing or applying the algorithms into the mega code. So I'll show you this app and I hope you like it, and at the end of the video I'll tell you what it is and how to download. Don't forget to hit the subscribe button below and the bell icon next to it. I hope you will enjoy the video. Let's start. So when you open the game, there is a disclaimer. It says, this game was created as entertainment to supplement the review and rehearsal of clinical scenarios during the learning process. Though inspired by real clinical problems, situations in the game are optimized for more engaging gameplay, including a faster time scale. The gameplay is based on 2017 knowledge of treatment of cardiopulmonary emergencies, but is not in any way intended to replace formal medical training or coursework. Means it does not replace the fact that you should read the book and actually be familiar with the algorithms. The development of this game was not associated with AHA or American Heart Association or other credentialing organizations. But in my opinion, the guidelines, the basis of this app are actually pretty close to what AHA has been doing, especially the 2015 guidelines. Finally, the gameplay of this app is based on medical knowledge and timely actions, so it could be more difficult for those without prior knowledge or training. If it is your first time to do ACLS, you might want to read the book first and actually be familiar with the algorithms first before you play this. For those who doesn't have any background of ACLS, you will probably not going to benefit from this, but you'll get familiar. If you want to try, you can try as well. I think it's better if we start with the tutorial, which is on the beginning day. Okay, so let's start with the day 1. Help! The patient is unresponsive and has no pulse. Let's call a code. Exciting. So there's a new doctor, there's a new resident who will help them with the code. Let's see what's going to happen. So here in the gameplay, the help, the number 52 here, is the most important part of the game. So you need to make sure that they don't go to 0. If they go to 0, if that number goes to 0, the patient dies. Alright, now the health of the patient is 80, going 75, going 70. As you can see, the patient constantly loses health due to his disease. Oh, I noticed the name of the nurse is Coconut. Why is it Coconut? Maybe because her head looks like a coconut. Anyway, alright, let's try to start CPR now. Okay, we click the heart and then start CPR. You see that? There's a star. Well done, doctor. Actions that benefit the patient get a positive green number. And actions that is potentially harmful will get a negative red number. See that those numbers? Yeah. Did you notice something? You got your first score. Yeah. You got 1 out of 8 star. Right. So everything that you do correctly, you might have potentially awarded with a point. But not all correct actions get a score. However, if you strictly follow the guideline, you'll get the full score for sure. Alright, in the game, as what I mentioned in the disclaimer, the time is faster. It's actually 4 times faster than the real world. The time moves pretty fast in the game, but you don't have to worry because when selecting a command, the game time slows down a little bit. However, the characters will still do whatever they are doing in the gameplay. However, that change has no effect on the gameplay itself. Now we will try to click the heart button again to see how it works. And when we close the panel, we'll be back to normal speed. You see that time? It's very fast, right? But when we select hard, the time goes or pass a little bit slow. So according to the coconut, we have done well so far. The crash cart will arrive soon, when we will evaluate the patient and look at the ECG. In cardiac arrest, we do a 2-minute cycle, and time resets every time or after each evaluation. You see those icons? There are different icons that is used in this gameplay. So we'll talk about those icons shortly. And so let's just continue with the tutorial. The game gives interpretation and treatment suggestions by default. This is under normal mode. So if you're going to select physician mode, then it's going to be, the app will actually think of you as expert, so they will not give any recommendation, no hints. So let's try now. So you can turn this off or even turn on manual ECG interpretation at pause, options, game mode, physician. Let's try to do that. So pause. Let's pause. Let's go to options. Now here you have options to turn on the sound effect on or off, the music on or off, and the game mode. Now we are at a physician mode. Physician mode means no diagnosis and treatment hints. If you are a beginner, you probably want to start with the normal mode where it gives you some hints. So we have changed that. So let's resume. The crash cart has arrived and everything is set up. Let's save a life. So here it says it's a ventricular tachycardia and the patient has no pulse. In the treatment suggestions, you will see those icons. The first icon actually means defibrillation, and the other two icons are CPR. This is a face mask, or not face mask, it's the bag mask ventilator and ventilation, and the last one is a picture of a syringe, so it means you have to insert an IV. So this is pulseless ventricular tachycardia. According to the guidelines, we need to defibrillate, which is actually what it says here as treatment suggestion. So we click continue and we will click the defibrillation later. So here it says some commands are executed immediately and there's no preparation time. Now, as you already know, the patient has a shockable rhythm, which is pulseless ventricular tachycardia. So we will defibrillate the patient and restart CPR immediately. Now we will take over from here and we will lead the code now. We will be able to see the treatment lag by the lag button next to the pause button. Alright, let's click heart and let's continue defibrillate the patient. And then we will need to say continue CPR and start the bag mask ventilation. Later you will see the person who's doing CPR will have energy levels. Now he is green, he's still good. When it becomes red, he gets tired. You need to switch him. Now they are doing CPR. Let's start an IV. CPR is ongoing. In real life scenario, you will do your H's and T's now, but we don't have options for that in this game. So 2 minutes is up. So what are we going to do next? The AHA guideline says after 2 minutes we need to stop, we will switch and we will analyze, and that's what we are going to do. So we will analyze. So the doctor is analyzing. It looks like it's ventricular fibrillation now, right? From pulseless VTAC becomes ventricular fibrillation. The treatment suggestions now are defibrillation, CPR, and we will give a certain drug. The AHA says you will give your epinephrine after the second shock. So right now we will shock the patient. Yeah, we'll shock the patient. Alright, we have already IV or IO access. In this hospital, we have a supernatural force looking out for our patients. So since we are in the tutorial, there's a little bit of delay on the treatment. But later on, when you go for the usual gameplay, it will be continuous. Let's go with the tutorial. So here it says there is a force looking out for the patients. So if you select a harmful action, the force will draw out or nullify that action, and it won't be recorded on the treatment record. It's like it never happened. I hope life is something like that. Are we confused now? After defibrillation and switching the person doing CPR, if you haven't done already, let's try giving him the wrong medication, a beta blocker. Remember I said earlier, the medication that we are supposed to give here is epinephrine, but we will give beta blocker, but it's completely wrong. Let's see what the system will do it in this case. Okay, let's give a beta blocker. It's wrong, okay? So beta blocker was given. That didn't help at all. Better not to do that again. And the system will say beta blocker was drawn out from the patient. Now let's give the correct medication, which is epinephrine. You notice you have another point because this is the correct medication. So we're doing CPR. We can start thinking about H's and T's again. We don't have time for that for now. Now 2 minutes is up. What's next? You stop, you switch, you analyze. Correct? Now we'll analyze its ventricular fibrillation. Although here in the animation, the physician checks for pulse. This is wrong because ventricular fibrillation, there will be no pulse. We can ignore that small glitch in this app. So now we analyze its ventricular fibrillation. Just remember, do not delay more than 10 seconds for anything. So don't check for pulse for ventricular fibrillation. So the patient has no pulse, there's ventricular fibrillation. So the treatment options here, as they suggest, is defibrillation, CPR, and we give another drug. Okay, let's continue. So we will defibrillate the patient, and now we need to switch and continue CPR. So CPR is ongoing. Now this is the third shock, isn't it? So we will give amiodarone at this time. 300 milligrams of amiodarone. It says 300 milligrams. It's correct according to the guidelines, right? So we can continue ruling out some H's and T's at this time. Hypovolemia, hypothermia. Now 2 minutes again is up. So we need to stop, we need to switch, and we need to analyze the rhythm. So there is an organized rhythm, right? So the physician needs, or the team leader needs, to check for pulse. In this case, the patient has a pulse, so the patient has returned in ROSC. Yes, correct? So let's continue. In the next video, we're going to explore the other cases here: the cardiac arrest, unstable bradycardia, stable tachycardia, unstable tachycardia, mega code 1, putting it all together, and mega code 2. So stay tuned for the channel. I will demonstrate to you how to use the app and the common treatments that are also available in the app. Meanwhile, I'll show you what this app is, and I'll show you how to download in the App Store. So the app is actually called Resus Days, as in resuscitation days. Yeah, the one I have right now is the full version because I bought it. It's not too much it's actually 12 dirhams. If you want to purchase the full version wherein you can start playing all of the levels, you can do so. By the way, the creator of the app, his name is Dr. Rath. He is a physician and he is specializing in health information technology. This is really a very good app, and if you have time, you try, explore, and download it from Play Store or in App Store.